Like and subscribe for daily OT brain boosters. OTR is preparing the parents of a preterm infant for discharge from the neonatal intensive care unit. Therapist provides education about home positioning and daily routines. Which activity is most important for the therapist to instruct the parents to avoid? A. Placing the infant in the prone position for sleep. Context. The biggest safety priority is safe sleep. Infants should be placed on their back for sleep, not prone, because prone sleeping increases the risk of SIDS in a sleep-related death. A pediatric occupational therapist is scheduled to provide home-based services to a child with developmental delays. Before the visit, the parent reports that another child in the home was diagnosed with active pulmonary tuberculosis earlier that day. Which precaution should the therapist use during the visit? D. Airborne precautions. A COTA working in a pediatric outpatient clinic learns that another COTA at a satellite location has been providing services for several weeks without regular supervision from an occupational therapist. COTA is concerned that this situation may not meet supervision requirements. What is the best action for the COTA to take first? B. Report the concern to the supervising occupational therapist. Context. The best first step is to address the issue through the proper professional chain of command, so the supervision concern can be reviewed and corrected appropriately. Child with profound developmental disabilities and multiple medical complications is receiving OT services in a pediatric long-term care facility. Child has a documented do not resuscitate (DNR) order. During a feeding-related positioning session, the child suddenly becomes unresponsive and shows signs of respiratory distress, but a pulse is still present. What should OTR do first? C. Implement the facility's emergency response procedure. Context. When a medical crisis occurs, the OT should first follow the facility's emergency protocol. This ensures the proper team responds quickly and that care is provided in a way that is consistent with policy, legal requirements, and the child's documented DNR status. Client with major depressive disorder is enrolled in a transitional employment program. After returning to work following a hospitalization, client reports that job demands now feel much harder and says, "I do not think I am performing the way I used to." OTR needs updated information about the client's current strengths and limitations before recommending changes to the plan. What is the best? C. Schedule a re-evaluation of the client's work behaviors and skills. Learned something or nailed it? Follow us to stay OT sharp. You got this.